emergency contraceptives. Emergency contraceptives help prevent pregnancy after unprotected sex, and they're important in that they help reduce unwanted pregnancies that might lead to abandonment, neglect, maternal deaths, or even unsafe abortions. They are 98% effective when used correctly, and this refers to their use within 3 to 5 days of unprotected sex. They are used only in emergency situations because it's a high dose of hormones that are taken at once, and this increases their risk of side effects. Some of the drugs that are used in emergency contraception include the progesterone-only contraceptives, and in this case they are used in higher doses. We have the 750 micrograms levonorgestrel pill, which is taken as soon as possible, and a repeat of the dose is taken within 12 hours of the first pill intake. So 2 pills are needed for protection from pregnancy. We also have the 750 micrograms levonorgestrel, and they are taken together as a single dose, and this is preferred because of increased adherence. We also have the levonorgestrel 30 micrograms, and this is just the regular progesterone only pill. And in this, it's also known as the use per method of contraception, in which 20 tablets are taken within 120 hours, that's just 3 days of unprotected sex, and a repeat of 20 tablets will be taken after 12 hours of the initial dose. It's not preferred since there is a huge pill burden that is incurred. And then also combined oral contraceptives can be used as emergency contraceptives. There are 2 dose options, and we have the low dose 30 microgram pills, for example microgynon. In this, 4 tablets are taken as soon as possible, and 12 hours later additional 4 tablets are taken. We also have the high dose 50 micrograms combined estrogen and progesterone contraceptives, for example eugynon, and in these 2 tablets are taken as soon as possible, and 2 tablets are then taken 12 hours later. We also have ulipristal acetate, and this is a new emergency contraceptive which is taken 30 milligrams as a single dose, and it has been registered in 72 countries. It's important to note that in emergency contraceptives, they do not prevent a pregnancy that already exists. They only work to prevent a pregnancy after unprotected sex. Some of the side effects that are most common with emergency contraceptives are nausea and vomiting. And if it occurs less than 2 hours after you've taken a pill, you should take another dose with an anti-nausea drug, which is also referred to as an antiemetic. You might experience breast tenderness, of which you can just take an NSAID such as paracetamol. Another thing that can be experienced is a delay in your periods, or they may come early or they may be very heavy, but the hormones will just normalize with time and everything will go back to normal. Emergency contraceptives can be used in situations where there is a condom burst, where there is a missed oral contraceptive, as I explained in my previous video, where an intrauterine contraceptive device has been removed, or if there is failed withdrawal, you can use an emergency contraceptive. Please let me know how your experience has been in the use of emergency contraceptives in the comment section below.